Is a debilitating disease where a person's immune system attacks nerve cells in the brain.
And how would you know if you or a loved one had it? And how is diagnosis different in minority populations?
To find out, we're joined by neurologist Dr. Toni DeMarcaida. I hope I got your last name right. I'm so worried that I'm going to screw it up. The medical director of Hartford Healthcare's Chase Family Movement Disorders. Thank you so much for joining us.
Yes, good morning, Scott. Good morning, Nicole.
It's a pleasure to see you. First of all, can you describe to our viewers MS and the process and how it starts and the process it takes?
Yes, I think that the attention on multiple sclerosis was raised by the celebrities Selma and Christina when they recognized that they had the disease and announced it to the world. MS is a neurologic condition that is caused by loss of the nerve sheaths within the brain and the nerves that will cause symptoms like stiffness of the muscles, paralysis of a limb, loss of vision in one eye, slurring of speech, and of course some cognitive impairment. Usually this would come and go, so we have relapsing, remitting multiple sclerosis where the symptoms would be present and then they would go away. But for some people, the symptoms just keep going.
And is this a genetic thing, or can anyone really get this?
There is a genetic predisposition, but it really can occur in anyone, most commonly in women, most commonly in that younger age group, 30s to 50s.
Are minority populations more at risk for this, or they're just undiagnosed? Could you talk to us more about that?
Thank you for asking about that. That is the reason why I am reaching out to you and to the Black and African American community. Historically, we used to think that MS was less common in Black and African Americans. Now we recognize that it is actually more common in people of color than we initially thought. Furthermore, in Black and African Americans, the disease tends to be more aggressive. Diagnosis tends to be later, and they are less likely to receive treatment. So these are the racial disparities that we at Hartford Healthcare's Eye Neuroscience Institute are hoping to address.
And Dr. DeMarcaida, how is Hartford Healthcare trying to address this disparity? What are you guys doing?
We have a series of lectures that started in October. It's called the Healthy Brain Series for Black and African Americans, occurring every month on the first Thursday evening at the First Cathedral. In December, we will be talking about multiple sclerosis in the Black and African American population, treatment options, symptoms, with our MS specialist, Dr. Brian Wong. In addition to the lecture series, what we're really trying to do is foster a relationship with the Black and African American community of Connecticut, earn their trust, and exhibit cultural sensitivity for this community. We want them to know that we are here, that we are instruments for their healing. And it's not just learning about these neurologic conditions that we want to convey, but we want to give them a forum in which they can have conversations with neurology subspecialists in various neurologic fields so that they can tell us about their concerns, they can ask us questions about neurologic symptoms, and, if appropriate, we can navigate their access into neurology care. Because Black and African Americans with neurologic conditions are less likely to see specialists, less likely to receive medication, less likely to take advantage of advanced treatments. So we want to make a difference.
Well, we have to leave it at there, but we can't thank you enough for your hard work and for bringing this to our attention.
Advance happy Thanksgiving to you both. Thank you for the opportunity.
Happy Thanksgiving.
So welcome. All right, like the doctor said, the MS seminar is the third of 6 free events in the Healthy Brain series for Black and African Americans. It will be December 1st at the First Cathedral. That's in Bloomfield. The talk starts at 6.
Great resources there.
Absolutely.